Welcome back to the ANS Way. This is part 3 in the series of understanding how medical insurance works in the USA. If you haven't already, I do recommend going back to part 1 and 2 where I explain firstly why you even need medical insurance in the USA and how the system is very different to the UK NHS system. And in part 2, I explain more about how you pick your plan and what all those various terms such as co-pays, deductibles, out-of-pocket means. In this video, I'm going to explain how you plan for those expenses by either using what is called a FSA, flexible saving account, or a HSA, health savings account. So you have picked a plan and you're probably thinking about that deductible and those out-of-pocket expenses that you need to make each year. Now, your premium is already covered by your pay through your employer. And just as a reminder, for the sake of this video, I'm only focusing on when plans are provided by your employer. Now, in the UK, because we have the NHS system, we don't really need to think about those medical expenses the same way that we do in the USA. But in the UK, we still need to think about prescriptions as an example. Here, you do need to think about that deductible and out-of-pocket. And it really depends on your situation how much you're likely to spend out each year. As an example, if you're relatively healthy, the likelihood of you hitting that out of pocket is very unlikely unless something unfortunate happened. On the other side, if you do have a chronic condition, the chances of you hitting that out of pocket maximum is much more likely. Therefore, you do need to plan for that. And the thing I would say with that is really do try and pick a plan based around your needs. So if you're likely to hit that out of pocket maximum, maybe consider a plan that has a lower out of pocket for you. So back to how you plan for your expenses. Now, first of all, you need to have a ballpark understanding. And what me and Ant done was essentially sat down and thought about, well, how many GP visits do we expect per year? How many prescriptions do we currently use and expect to use? And then consider perhaps one ER A&E visit for the both of us. Now, our plan, and the same should happen with you, you should have a list of all the services on your plan and the costs, so the co-payments that you need to make or the co-insurance, and we use that to make an estimate of what we think we're going to pay for the year. Now, I can't actually remember the number, but for the sake of this video, I'm just going to say that we estimated around $2,000 for us. You are probably thinking, well, okay, if our expenses are $2,000 each year, surely we just put $2,000 away and that's our money that we use to pay for our medical expenses. Or perhaps we think about saving a certain amount to make up to that $2,000. Well, no, this is where the flexible savings account and HSA comes into play, because these are accounts where you can save pre-tax money. And this is something that would be near and dear to Anton's heart here. So these accounts allow you to save pre-tax dollars that you can use for medical expenses as well as dental and vision. They are similar in the fact that they are pre-tax money, but the way both accounts work are different in terms of whether you qualify, the amount you can contribute, the rules, rollover, how you can withdraw, and this is what I'm going to cover in this video. Let's start with the FSA. These must be set up by your employer. That means this account is actually owned by them, and you must have a plan. You can't just have a flexible savings account without having some form of a dental, vision, or medical plan with your employer. The amount that you can contribute and the amount that you select to contribute, there are different rules between this and the HSA. So for the flexible savings account, the maximum you can contribute in a year is up to $2,750 in 2021. This is linked to what the IRS set. So it changes each year. So that's the maximum that you can contribute. But once you choose the amount, and this is prorated for the year, so if you start halfway through the year, then obviously you can only contribute half of that amount. But the other thing to think about is at the beginning of the year or whenever you start the plan, the amount you set is the limit. So as an example, if I choose this year to only do $2,000 when I sign up, I then can't choose halfway through the year to change that amount. So whatever you set at the beginning is the amount you are set with for the rest of the year. A key thing with the FSA is that the funds are available from day one, and this is the great thing. So you don't have to wait to accumulate the money. And the best way of understanding how this works is an FSA is like a credit line. So when you open the account, and let's say in this example, we want to set $2,000, the company will credit that account with $2,000, even though I haven't yet contributed $2,000 to that account yet. And each month, or depending on how I'm paid through my employer, they will take a set amount towards that. So in the case of $2,000, because I'm paid bi-weekly from my employer, I will be paying around, I think it's about $79 each paycheck. And that contributes to that amount. So it is on the understanding that I'm going to eventually pay off that amount by the end of the year. But what if you don't use it all? So we've estimated about $2,000 for our year. What if we don't use it? Well, before I explain that, I'm going to take a moment here to stop and ask you to hit that like button. And if you've been watching this channel, or maybe you are new to this channel and you haven't subscribed yet, please do subscribe. Now back to FSAs. This is the key thing. FSAs are generally a use it or lose it account. So whatever amount you set, the idea is that you are actually going to use that amount by the end of the year. However, there are some rules, and this is very dependent on the rules that your employer sets. There are conditions from the IRS, but in my example, with my employer, with my FSA, I can roll over up to a maximum of $500 per year. So in my case, let's say $2,000 and I only use $1,500, I know I've got $500 that will go into next year's pot. In terms of the tax advantages of this account, it's really the fact that you're using pre-tax money, and it's really a good idea. I do recommend using this account if you can. And then we'll get to HSAs in a moment, but it's common sense. Rather than waiting for that money to go through your paycheck, the tax take it, and then spending money on your medical expenses, take that money. There are definitely going to be medical expenses each year. It's just the difficulty is knowing how much, but this is the benefit. It's pre-tax money, and that's the only advantage in terms of tax advantages. It isn't used for growth investments, and this is where I'll come to the HSA in a moment. Lastly, in terms of what you can use the funds for, it is only for medical expenses. So medical, dental and vision, depending on the type of FSA that you have. There is such thing as a limited FSA, because perhaps you can only use it for dental and vision, and that's typically when you have an FSA and a HSA. So you can't have both at the same time, but you can have what they call a limited FSA for dental and vision and a HSA for your medical expenses. And the last thing I'm going to say on the FSA is and I'm going to just reiterate the point that I made at the beginning, the account is ultimately owned by your employer, which means if you change jobs, the money is with them. You can't port that to another employer. So do consider that and do think about that. Now on to health savings accounts, HSAs. I love the US medical system. I'm just going to stop here for a moment and digress. I've never known so many acronyms used, and I'm always laughing in business because we use so many acronyms, but going through this process of learning the medical system, PPO, HMO, HSAs, FSAs, it's quite funny to me. But anyway, HSAs. To qualify for one of these, you do need what is called a high deductible plan. So if you've watched part 2 of my series, that is where the deductible is over. I believe this year it's about $1,400 for an individual. So that is considered a high deductible plan. If you have a lower deductible plan or a zero, which is possible, you would not qualify for a HSA. So just to note, you need a high deductible healthcare plan in order to qualify for this. With the HSA, unlike the FSA, you actually own this account. So this isn't owned by the employer. you own this account, and as you move jobs, you can keep this account with you. A bit like a pension. Sometimes you can keep that pension or merge pension. So this is your pot that you keep with you. And in terms of the contribution limit and selection, as an individual, it is $3,600, and for a household, I believe it's about $7,200. Again, like the FSA, I think that limit is determined by the IRS. And you can select the amount. So much like the FSA, you can select the amount you want to contribute to that account. But unlike the FSA, you can change it during the year. You are not confined to setting that amount at the beginning and you are then stuck with that amount for the year. In our case, where we said about $2,000, we could start with that. But if we think actually we need more, or we believe we're going to use more services, we could up that amount to $3,000 or even more. In terms of the fund availability, again, this is where it's also different. With the FSA, you select the amount, and even though you haven't contributed that $2,000 yet, you can use that from day one. With the HSA, it is not the same. So FSA, think of it like a line of credit, which eventually you will pay off. HSAs is more like a savings account. You can only use what you have already contributed into that savings account. So the funds that are available are determined by the amount that's already in that account. So do be conscious of that when you open these accounts initially. With the HSA, you can roll over the money. Unlike the FSA, where you might not be able to, or you're capped at a small amount, the great thing about the HSA is that, let's say you don't even use any of the money that year, all of that will roll over that year, and every year, in fact. So this is one of the great things about this account. You can really accumulate a pot of money that you can use towards medical expenses. And in terms of the tax advantages, well, they're almost triple-fold, because not only can you use pre-tax money to save and build up your money that you want to use for medical expenses, but on top of that, you can invest your money. So this is great. So you can invest your money, and that money that you earn, whether it's interest and growth, is also tax-free. So this is one of the beautiful things about this account, is that you can really leverage that account for growth and maximize on that over time for your medical expenses. In terms of how you can use the funds and withdraw the money, this is where it is also very different to the FSA. Now, the account is actually for your medical expenses. That's what it's designed for: medical, dental, and vision. But unlike the FSA, you can actually withdraw it for other things if you need to. Now, if this happens before you are 65, there are penalties. You'll owe the tax back that you've gained from that pre-tax, so you'll have to pay that back. And on top of that, the money you withdraw will also be taxed. So that's really not advised, but you know that you can take it out should you need to. If you are over the age of 65 and you choose to withdraw that money, then it's just, the tax is like an income. So you do have this much more flexible way of using those dollars over time. But remember, that account is really meant for your medical expenses. And this is the key thing. Pre-tax money, you can invest over time, the money rolls over. It's almost a bit like a pension pot, but for your healthcare expenses. In the US, one thing to really think about, and especially if you are moving here and you think you're going to settle here, you really do need to think about your retirement and also how you're going to cover those costs. There isn't an NHS system here that you will know that will cover you for your medical expenses. So what's great here is, if you save into this pot, if you choose to retire at 50 years old, as an example, you can use that money to cover your medical expenses and not have to rely on an insurance plan. It really depends on how you invest over time and grow that account. You may still need a medical plan, but at least you've got a pot of money there that you can use to cover your deductibles and out-of-pocket expenses. One thing to note, in the US, there is Medicare. I get confused between Medicare and Medicaid, but when you're over 65, you are covered by that as well. So just to know, it's not a case of when you're in when you're in your 70s, you still have to think about this pot of money and how do you cover your medical expenses. There is insurance plans, Medicare, for when you're over 65, but this is an extra buffer should you retire early or need extra money for your family during that period. The next thing I'm going to reiterate, and just to summarize, these are great ways, both of these accounts are great ways to leverage pre-tax money and to cover those expenses that you will have each year, but you cannot have both. You cannot have an FSA and a HSA. So depending on what plan you pick with your employer will determine which one is available to you anyway. But if you are in the position that you decide, well, actually I am going to stay here for many years, I want to think about building that pot of money, I want the HSA, what you can also do is take out a limited FSA if your employer offers that to you. So that means you use your HSA for your medical expenses, but then are not consuming that money for dental and vision, and that's where you use the limited FSA for your dental and vision. And that's just a very clever way of leveraging both accounts each year. And there you have it, FSAs and HSAs. There is also something called a HRA, a health reimbursement account, but I'm not going to cover this. It's not something that is being offered to me by my employer. But if I do find out more about it, I will share that with you over time. So there you have it, part 3 in the series. And if you've been watching them all, you should understand now why you need health insurance in the USA. You should be able to understand all those terms and how to pick the plan for you depending on your situation. And now you should also know how to save for your yearly medical expenses. In the next video, I do plan to share a bit more about what me and Ant have decided to do, because maybe that can help you with our logic. And I have pretty much followed some of the tips and advice that I've given throughout the free videos. But the next video will be more specific about our health plan and whether we've taken a HSA or an FSA. If you've watched the second video, you should know, because I do mention something about the type of plan there. So you should probably know whether we have a HSA or FSA. This is me testing you for attention to detail. As usual, thanks for watching. Please do comment below. Let me know what you think. What do you think about the fact that they have these types of accounts and incentives and ways that you can use pre-tax money? I personally think it's a great system and much more of a peace of mind. But yeah, please do comment below. Do not forget to like and hit that notification bell, because then you'll be notified when we release all of our wonderful videos. And if you haven't subscribed yet, please do subscribe. Thank you for watching.